She just wanted to lose weight. Those were the words of the husband of a young woman I had the chance to work with. And you know what? I completely understand. In a world that constantly tells us we need to look a certain way, the pressure is real. What could be better than living your normal life, eating whatever you want, and still losing weight? And all it takes is one small thing, constantly vomiting everything you've eaten. Sounds like a perfect plan, doesn't it? I mean, you can eat a piece of cake and literally not keep it. But here's what truly strikes me about this approach. What could possibly go wrong with this perfect solution? Let me tell you about something called Mallory-Weiss syndrome. It's a tear in the mucosal lining of the esophagus, and it happens with frequent vomiting when the esophageal lining is damaged by food remnants and stomach acid. I'm not here to judge anyone. I've seen too many people struggling with body image, with eating disorders, with a desperate desire to look a certain way, and I understand where it comes from. But what I want to share with you today is why this particular path is so incredibly dangerous, and more importantly, what is actually happening inside your body when you go down this road. Before we dive deeper, if this information is helpful to you, click the subscribe button. I share these medical insights because I genuinely believe that understanding what's happening in your body can literally save your life. And honestly, that's exactly what we're talking about today. So let's talk about Mallory-Weiss syndrome. The severity of this condition depends on three critical factors. First, how massive the tear is. Second, how quickly the patient's condition was noticed. And third, how quickly help was sought. These three things can literally mean the difference between life and death. Here's what is simultaneously fascinating and terrifying. Your esophagus, that tube connecting your mouth to your stomach, is not designed for constant reverse movement. It's like a one-way street, you see. Food goes down, and that's it. But when you forcibly push things back up again and again, you are essentially sandblasting that delicate tissue with stomach acid and partially digested food. Think of it this way. Imagine you have a garden hose. Now imagine running sandpaper through that hose over and over again. Eventually, what happens? The hose tears, right? That's essentially what happens with Mallory-Weiss syndrome, except it's not a garden hose. It's your esophagus. It's the tube you need to eat, drink, and survive. And here's where it gets truly serious. When that tear occurs, you're not just dealing with a small cut. You're dealing with blood vessels that can start bleeding, sometimes a little, sometimes a lot. And stomach acid, it doesn't help with healing. It makes everything worse. It's like trying to heal a wound by constantly pouring lemon juice on it. The scary part is how quickly things can escalate. One moment you think you've found the perfect weight loss solution, the next moment you're vomiting blood. And let me be absolutely clear about this. If you notice blood in your vomit, you need to get to a hospital immediately, not in an hour, not tomorrow, immediately. This can save your life. I remember working with this patient, and what struck me most was that it wasn't just the physical harm, it was the psychological trap she had fallen into. She started with a desire to lose just a few kilograms, maybe to fit into a dress for some event, something that seemed reasonable in her mind. But then it became a cycle. Eat, purge, repeat, eat, purge, repeat. And with each cycle, she was damaging her body more and more. Here's what many people don't understand about bulimia and purging behavior. It's not only about esophageal tears, though those are serious enough. It's about the cascade of problems it creates throughout your entire body. Your teeth begin to decay from the acid. Your electrolytes become completely unbalanced, which can affect your heart rhythm. Your salivary glands swell. Your metabolism gets confused and actually starts working against you. And here's the truly cruel irony. This method doesn't even work for sustained weight loss. Your body is smarter than you think. It adapts. It starts holding on to every calorie it can because it thinks you're starving, which in a way you are. So you end up in this terrible place where you're damaging your body and not even achieving the goal you set. Let me break down what actually happens during a Mallory-Weiss tear. The esophagus has several layers, a bit like a wall has drywall, insulation, and an outer covering. With repeated vomiting, the inner lining begins to break down first. Small erosions appear. If the behavior continues, these erosions can develop into deeper tears that pass through multiple layers, And when you break through to where the blood vessels are, that's when bleeding begins. The bleeding can range from minimal to life-threatening. Some people may see only streaks of blood. Others may vomit what looks like coffee grounds, which is actually partially digested blood. And in severe cases, you may vomit bright red blood, which indicates active, significant bleeding. Each of these scenarios requires immediate medical attention, but the last one, that is a medical emergency in every sense of the word. Now I want to talk about something that isn't discussed enough, the psychological component of eating disorders. Because here's the thing, understanding the medical dangers is important, but understanding why someone would continue this behavior despite the dangers, that is equally important. Eating disorders are mental health conditions. They are not about vanity. They are not about weak willpower. These are serious psychological conditions that require professional help. The person I worked with, she knew the risks. Intellectually, she understood that what she was doing was dangerous, but the disorder had such a powerful grip on her thinking that the immediate relief of purging felt more important than the long-term consequences. And that is the trap. That is what makes eating disorders so incredibly difficult to overcome without proper support. Here's what I wish more people understood. If you or someone you love is struggling with bulimia or purging behavior, help is available. And I don't just mean medical help for the physical damage, though that is absolutely critical. I mean psychological support, therapy, support groups, treatment programs specifically designed for eating disorders, because you can't just treat the physical symptoms and expect the behavior to stop. You have to address the underlying psychological factors. The recovery process is not easy, and I'm not going to pretend it is, but it is absolutely possible. I've seen people recover from severe eating disorders and go on to have healthy relationships with food and their bodies, but it requires acknowledging that there is a problem, a willingness to seek help, and a commitment to the recovery process, even when it's hard. Let me give you some specific warning signs to watch for. If you notice someone frequently going to the bathroom right after eating, if there are calluses on their knuckles from inducing vomiting, if you notice dental problems or swollen cheeks, if they are obsessively concerned with body image and weight, all of this can be signs of bulimia. And if you are the one experiencing these things, please understand that seeking help is not weakness, it is strength. The medical complications go beyond just Mallory-Weiss syndrome. Chronic vomiting can lead to something called esophageal rupture, which is even more serious than a tear. It can cause aspiration pneumonia if vomit enters the lungs. It can lead to severe dehydration and electrolyte imbalances that affect your heart, your kidneys, your brain. The human body is interconnected, and when you damage one part, it reverberates through everything else. But here's what gives me hope, and what I want to leave you with. Your body has an incredible capacity for healing. The esophageal lining can regenerate, electrolyte balance can be restored, teeth can be protected with proper dental care. But all of this healing requires one critical step, stopping the behavior that is causing the harm, and this is where professional help becomes essential. If you're watching this and recognizing yourself or someone you love in what I'm describing, please reach out for help. Talk to a doctor. Contact the National Alliance for Eating Disorders. Find a therapist who specializes in eating disorders, because the sooner you get help, the better the outcomes generally are. Before we wrap up, write in the comments what topics you'd like me to cover next. Your suggestions help me create content that is truly useful for you. Recovery is possible. Healing is possible. But it requires acknowledging the problem, seeking professional help, and committing to the process. And if you see blood in your vomit, that is your body sending you an alarm signal. Don't ignore it. Go to the hospital immediately. That simple action can save your life. Your body is trying to tell you something. Listen to it, respect it, and give it the care and professional help it needs. Because you deserve health, both physical and mental, and that journey begins with one brave step, asking for help.